Hi, this is Dr. Forley. I want to be going over with you about brain-based care, functional neurology, and how by doing all of these treatments in here, they're impacting the way the brain works, the way the immune system works, and the way all your hormones and your endocrine system works. So there's a diagram on here, but it's very simple. Your body streams information to the brain through receptors that are located in your skin, muscles, and joints, eyes, ears, smell, and taste. Those are your sensory inputs. Those sensory inputs are constantly activating, and they are like a nutrient that the neurons require to work properly. So neurons, the brain, needs three things to work properly. It needs proper activation from these receptors. It needs proper oxygen, and the neuron needs proper nutrition. But just the basic neurology here. When you get brain-based care here, this is not snake oil. This is sound physiology. This is how our brains work. And we can make the brain work better without drugs or medication, because the drugs and medication are not normal and natural to normal physiology. It is not one of the three things the neurons need, which again is activation, oxygen, and proper nutrients. So the way that it works is, if this is me, this is the right side of me, this is the left side of me. This is my right cerebellum. The cerebellum is the back and bottom of the brain over here. So the cerebellum are these little balls that are on the back of your brain here. So this is me sitting like this. Although they're very small, 50% of the total neurons in the entire brain are inside the cerebellum here. So they're very, very, very important. The cerebellum basically is the junction between the body and the brain. The brain cannot get healthy with a weak cerebellum. Now the biggest inputs to the cerebellum comes from receptors located in your skin, your muscles, and your joints. And over a time frame, there's the posterior columns and then the spinal cerebellar tract and the cuneo-cerebellar tract that activate that cerebellum and then cross over and activate the opposite side. So this side of my body activates this cerebellum, and then we'll cross over to this cortex and then back down to this side of my body. That's the diagram here. So there's the biggest input as far as the receptor input comes from the muscles, joints, and skin. And it will activate that same side cerebellum. That will cross over and activate the opposite cortex and then down to your body, and it will impact your hypothalamus, which runs all of your hormones, and will also impact your autonomic nervous system, which has two branches. Your parasympathetic, which is rest and relaxation, and your sympathetic, which is the stress response. So over a time frame, when you come in here, we do our evaluation. We try to measure all of this the best we can. You do the NSI test, which has a lot to do with multiple different areas of the brain. And then we do the autonomic test, which has a lot to do with this whole PMRF and the IML. So over what happens also, when we work with you, we go down to the muscles, joints, and skin. The area that has the most abundant receptors is in your spine. It's in the center of you. But the most abundant is your upper neck. Second most abundant, your feet. And then third is the entire spine overall. So although there's many areas that you can tap into these receptors to activate the brain, these are the areas where they're the most abundant. What does it mean? If that's the area where there's the most abundant, it means that's the area that's going to have the biggest impact on overall brain function and those neurons working properly. So we fire in to the muscles, joints, and skin, fires into the right cerebellum. The tract that carries this from here to here is called your dento-rubro-thalamic tract. It goes to your left thalamus, then to your left cortex, and then back down to the left side of your body. So treatment on the right side of your body will activate the right cerebellum and impact the left cortex and the whole left side of your autonomics coming down. Also on a time frame, if we're talking about muscles, if we work on the weak right cerebellum to get at the left cortex, that will impact the muscles on the opposite side of the body. The other thing that you want to know is that your vagus nerve, which is really what your PMRF stands for, that's called your pontomedullary reticular formation. It's in the brainstem part of the brain. The lower brainstem inhibits or turns off the upper brainstem, which is the IML. So the PMRF, this is your parasympathetic, rest and relaxation. And the IML, this is your sympathetic or stress response. So if the brain is working well, your PMRF will dampen or quiet down your stress response. If not, we see a stressed out system. And what do we see in a stressed out system? Improper digestion, improper hormone balance, improper immune function. We see sleep abnormalities. We can see blood pressure issues. We can see high cholesterol. We can see swelling. We can see allergies. We can see all of the signs that the system is stuck in a stress response. And the stress does not mean that you have mental emotional stress. It means this loop is running too much. And there's multiple different things that can impact that. The 3 types of stressors that run this. Physical stress, meaning if you're not getting proper activation, that's a physical stress, and that's going to throw this balance off, and your system's going to be stuck in a stress response. The second component is mental emotional stress, worry, and that kind of stuff. And that's where your mindset comes into play. And you have to focus on what you want, not what you don't want. Don't talk 500 times about what you don't want. Don't talk about how things have not worked in the past. You got to be focusing on what you do want. If you have issues with mental emotional stress and keeping yourself on track, we have a great counselor that we work with. She's totally supportive of all this, and she should be someone that you work with to keep your mind, mental emotional stress, on track so that you're moving in the right direction. And then the third type of stress is chemical stress. This comes mainly from foods and drink that are improper. So if we've given you a list of the foods and say don't eat these, you can't eat those. Because if you eat those, you're creating this stress response over and over and over again. What we find is that most patients come in, if this stress response is supposed to run 50 times a day, it might be running 500 or 5,000 times a day. And you just get broken down mentally and physically. You also can never heal anything if the stress response is through the roof. So over a time frame, that's what we're doing. One more thing you want to know too. As you activate from the body up to the brain, you not only change how the body works, you change how the brain works. And there's 3 different motor systems. So input drives output, input, output. So we're not guessing. We're going after the areas that we know carry the biggest amount of receptors. And then over a time frame, what we're doing is we're activating those receptors to get this whole loop to work properly. And then we see as the nervous system goes up in function, everything follows. Immune system works better. Endocrine system works better. That's all your hormones. That's your thyroid. That's your blood sugar. That's your sex hormones. All that starts to shift. And the other thing we have to keep in mind too is a lot of people are coming in here that may be showing signs of Parkinson's, Alzheimer's, depression, anxiety, bipolar, all those things. When we do this, we're directly impacting the brain function. All of your neurotransmitters are released on the output side. Did you hear that? They're released on the output side. It means that new input absolutely changes the output. So you can get better better neurotransmitter balance through this activation process. There's 3 different motor systems directly within the brain that are impacted from this activation. So the 5 total motor outputs that improve by this. Number 1, autonomic nervous system. So this is your heart, your liver, your lungs, your thyroid, your blood sugar, your sex hormones, and all your subsystems, the immune system, all that works better. Number 2, somatic nervous system. This is the musculoskeletal system. This is the skin and the joints, all of that. So people immediately go, wow, my body just feels looser. If I'm a Parkinson's patient, I might notice that I'm moving with a little bit more flow. If I had weakness getting off the chair, I might notice that that's better. I might notice that, hey, the pain I had in my neck is gone. I might notice there's no more tingling in my feet. All that can change. And then there are 3 different motor systems within the brain. There's the oculomotor attention motor system. This has a lot to do with decisions and gut feelings. Cognitive and associative motor system. This is racy thoughts, memory, OCD, inability to focus, all that kind of stuff. And then lastly, limbic emotional. This is moods, anger, stress, and the ability to respond. This is depression, anxiety, can even be bipolars where you're all over the place. The way to reestablish normal brain function is to give it the number 1 thing it needs, which is activation through this process. And immediately you get new output. Once you get that new output, then over a time frame, you can begin to heal. So I hope this was helpful and look forward to seeing you on your visit.